Okay, hello, Mrs. Abrahams. My name is Dr. Gordon. Welcome.
Hello, Dr. Gordon. How are you, Dr. Gordon?
I'm very good, thank you. But more importantly, how are you? How can I help you today?
Doctor, I'm okay. You don't mind us sometimes. My English sometimes isn't so lekker, so I'm going to go so between. Do you understand me? No?
Ek verstaan, no problem.
My English isn't so lekker. Okay. And sometimes when I want to, how do I say now for explain how I feel, then I don't always use the words right. No, you mustn't laugh, no?
No problem. I understand.
Okay. So, doctor, I was at home and I was thinking about this appointment and I was praying. I was sitting and I was praying that I'm going to get a lady doctor because, my problems is I wouldn't be able to speak to a man about these things. I'm so glad. And look there, God answered my prayers now. I got a lady doctor. So I'm really grateful. Thank you, doctor.
You are so
now,
welcome.
Doctor, what my problem is, doctor, I'm so glad you're a lady. It's with a vagina, doctor.
Mm-hmm.
Ek het nou lang gevat. I took very long to decide to come and actually see a doctor about this problem.
Mm-hmm.
Because, as old people, we don't talk about this so much, man. No? And in my community, we don't talk about those things. No?
I understand.
So I thought, no, but it's my health that I need to think about. And my problem, doctor, is that it's made things a little bit, how do you say, tense with my husband, man. You see? So now my problem is, I'm taking long because I don't know how to say it, doctor.
It's no problem.
My problem is, doctor, that, every time, sometimes I feel that there's something sitting in my vagina, and sometimes it's coming all the way out. And I'm very worried because my mother had it and then she died, and I thought it was cancer. So I'm very worried that this thing sitting in my vagina is cancer. And then sometimes when it's hanging, it can be quite uncomfortable. I'm going to be talking a lot now because it's the first time I'm talking about it, and it's, I didn't have anyone else to talk to. You must stop me if I'm talking too much, okay?
No problem. Keep going. Just get it all out.
So I'm very worried that it's something really serious, and that's why I'm here today. But then there's also something else that is very, very embarrassing. And the thing is, when I cough, and I've got asthma, so I cough a lot. I use my pump a lot. Sometimes I even have to use my pump every day. Not my normal pump, the one that controls everything, but the one that when my chest is tight, that one that I must use. And sometimes I must use it every day. And I remember the doctor said that, if I'm using that pump, what is it, the Ashta something, that pump, no? Astavent, yes. So that pump, the doctor said I mustn't use too much because it can cause problems. So I know that my chest is not lekker. So now I'm also coughing and it's cold and the wind is blowing and the pollen is out. And it's not COVID. I know because it's now my chest is, man, it's not COVID. But so when I cough and then pee comes out, and I used to be such a jovial person, and now people saying, Gadija, what's wrong with you? You don't laugh like you used to laugh. And I was always the one that used to make, the jokes. And you go out and my friends, or I go to the family functions and I eat ons lekker cook and I'd make jokes and good. But now, now I'm so worried when I'm in a laugh and then a pee comes out. And then, now the children make fun of me and the children say, sis, mommy, like, sorry for my language now, but then they say that, and then it makes me feel so bad. Yeah, and then I play outside. I used to play outside with the children, and I used to jump and play hopscotch and, do all of those things. But now when I jump and then it pee comes out, so I don't even want to play with the children outside anymore, doctor. I'm sorry, I'm talking such a lot, doctor.
It's okay. It's okay. I'm starting to get a clear idea of what's happening, and it sounds like the situation is really affecting you. It's causing you quite a lot of distress. So I just need to go through and ask you a few more questions so I can understand exactly what's going on so that we can help you the best way that we can. Okay. So you are 55, hey?
Yes, doctor.
5 years old. Okay. And now when did this problem start? This problem of feeling a lump coming down and the problem of peeing when you laugh or cough?
So the lump was maybe around about maybe 1 year or so, and then the pee problem was a little bit longer. I didn't really want to talk about it. It's the first time, so I think it may be 4 years, maybe 5 years.
Okay, so it's quite some time. And can you tell me, how often do you go and pee during the day?
I can actually maybe only go maybe 3 times a day. Ek is so besig in die huis, besig dan vergeet ek. Then I'm so busy and I don't really think about going to pee. So I don't pee so much, maybe 4 times.
Okay. And at night, maybe you get up at night to pee?
At night, maybe just like 1 time. Okay. 1 time, it's not too bad, yeah.
Okay. And do you ever have the feeling of like you have this urge to pee and it's so strong that if you don't get to the toilet immediately, you're going to wet yourself?
Nee, doctor, no. Okay. I think I can ook knyp, no? It's just I keep my bladder ends are getting very full, but I can keep it in. It's not a problem.
Okay, good.
I need very lucky.
Okay. And do you ever have any pain when you go and pee?
No, I had pain, but that was a long time ago. And then I went to the clinic and they said I had an infection, but that's better now. So I don't have pain now, no.
And do you tend to get infections quite often, bladder infections?
Not really. I had the last one. No, and the last one was a year ago. So not really, doctor.
Okay. And do you ever see blood in your pee?
No, I never saw blood.
Okay. And do you ever feel when you're sitting on the toilet and you are waiting to let all that pee come out, do you ever feel like it's difficult to get all the pee out, that maybe some is left inside? Or does it feel like it all comes out?
Actually, doctor, sometimes when I feel like that ding is it uit now, the thing is hanging out, when I can feel it outside, then sometimes I must, I move so bitchy, I move a little bit, or I stand up, and then when I stand up, I feel, daar moet ek weer gaan, then I go sit again. So then when I sit again, then all the pee comes out. So sometimes I have to
go twice in a short period to empty. Yes. Okay. Yes. And do you ever find do you ever find that you have to push that lump back in with your fingers in order to be able to pee?
Sometimes I don't want to tell anyone because I don't want to touch women.
I know, I understand. Yeah. I understand. So these problems, we're going to get to the bottom of all these problems that you're telling me about. But they're very common and they happen to a lot of women, but there is a stigma. People don't talk about it, but we are going to talk about it from beginning to end so that we make sure we get everything that we need. Okay, so we can help you. Okay, so do you have any problems with constipation, difficulty passing number 2?
So on and off. But it's been a long thing. But ik vat so No, ik vat so my huisraadjies and then it gets better. Sometimes at brown tablets that they get at the clinic.
Yes.
Or so that bitter aloe seal is baie goed, that bitter aloe, then I take that and then
it helps. Okay. And now I'm going to ask you some questions of a more personal nature because it's all related and it's all important. Are you married? You said you are married, and there's
Ja,
some.
my man is daar.
Okay, and you
Ons is
said
lang
that.
saam.
Okay, you said that this lump that's coming down is causing some problems in your relationship. Can you tell me a little bit more about that?
Yes, doctor. You see, it's not something, that is, we don't talk about these things. And my husband, sometimes I'm worried that he's going to go somewhere else, no? And, it makes me very worried because we were married 30 years already. And he's still very energetic, he's got lots of energy he wants to burn off. And when I went through my change of life, I was still there with him, and we were doing our things. But sometimes I didn't feel like it, but then there were other times I wanted to. But then with this problem now, doctor, it's actually sore, man, and then I don't really enjoy it so much. When it goes in, then it's dry. And sometimes it's sore when he goes in. And then the other times now, like what's happened now, the last few times that we were together, I was so embarrassed and I didn't want to talk to him about it. So now I just say, nee, Muhammad, ek wil nie, Muhammad. Because what happened was that I peed, on him, and when he went inside, I peed, and I was like, as soon as I stopped, and I said, no, ek het nie nou, Lissy, gaan maar, go sort yourself out. Because, to go pee on someone is most embarrassing. So last week he said, let's go. And last week he said, let's do something to say, Muhammad.
Okay.
So I'm really worried.
So you're worried that he's going to look elsewhere for sex, is what you're saying?
Yes.
Okay.
Yes.
Has he ever reacted badly towards you when you said you didn't want to have sex with him? Has he ever scowled at you or lashed out or been violent?
He's actually a very, I must say, thank you to God, because he's a very good man and he's very loving, and he's understanding. But my generation people don't talk about sex and those things, man. But he said, what is fout, Gadija? Kan ek met iets help? Terwyl ek gepraat het, I didn't want to talk to him about it when he asked me what was wrong. Can you work on it or whatever? Because I was just so shy. But he's a good man. I really can't complain. But I just was too shy to talk to him.
No, I completely understand that. Okay, so there's a few other questions that I need to ask you. Things that all can contribute to the problem that you are having. So how much would you say you drink during the course of a day, and what do you drink?
Okay, so ek het 'n koppie koffie in die oggend, so coffee in the morning, and then maybe a cup of tea at lunchtime, and then maybe 2 glasses of water.
Okay.
And a cup of tea at supper.
Okay, that sounds fine.
And I think mostly rooibos tea.
It's rooibos tea as well. Okay.
Yeah.
And tell me, do you have any other medical problems that you're taking treatment for every day? You said you've got the asthma that you're using a pump for.
I've got asthma. Yes.
Your asthma is not very well controlled.
Especially this season, not so much. Yeah. Because I'm using that pump a lot.
Okay. And any high blood or diabetes? Yes.
I've got high blood pressure, but I'm on the water tablet. But no, nothing else. No diabetes or anything else. Nothing.
Okay. And when have you had any operations before?
Just the Caesar, just one Caesar, nothing else.
Okay. And tell me, how many do you have any children?
I've got three
children.
3 lovely children.
Okay.
Yeah.
And did you push all your children out, or did you have a Caesar?
So my last born baby, Ismail was a Caesar, but then the first one, Amina was what that spoons that they use.
Okay.
No? Because I was struggling and the baby didn't want to come, so they used the spoons and I had an ugly day, you know. That's also why I'm so shy sometimes. But they fixed that fine. They fixed it immediately afterwards, and then it was okay. It wasn't any problems. And then the second baby was fine. There was no problem.
All right. And can you tell me when your last pap smear was?
Oh, I went for a pap smear last month. I'm just waiting for the results. They said it will take some time now with COVID.
Okay. And something that we like to ask everyone, because we have to, is have you had an HIV test recently in the last year, 6 months?
No, I've never had an HIV test, doctor.
Okay. So that's always something we advise for sexually active people, you know, even if you've been married for a long time, it's just a good idea to do that and to do it together if you can.
Yes, doctor.
Okay.
Yes, doctor, I understand.
Okay, so it sounds to me like you have got something that we would call a prolapse. And now what is a prolapse? So when women get older and the further away from menopause you get, you see it in your skin, your whole body, things start to dry out and get thin and start sagging downwards. And sometimes that can happen to we call it the pelvic floor. So the bottom of your body that keeps the womb in place and the bladder in place, sometimes that can start getting a little bit tired and loose. And so sometimes the womb can come down a little bit, or the bladder can come down a little bit. And that can make you feel like this lump that you're feeling. And it can also give you all these PMS. So I'm going to examine it now, and that's what I'm going to be looking for. And there's lots of different options and different things that we can do to help you. One of the main things we're going to have to look at is your asthma, because the more you cough, the more the pee is going to escape. So we have to look at that. But there are some things that we can do for that area specifically. But I need to examine you first so that we can decide what our next steps are going to be. Okay.
Sure, doctor. Sure, I must thank God also. But sure, you know what was worrying me why it took so long? Because I thought it was cancer. I thought it was cancer, and I thought that is what killed my mother. But I feel so relieved now. I spoke to you, and you're saying that it's that thing that you said. What did you call it again?
Prolapse.
Oh, sorry, prolapse. Prolapse. Okay.
Yes.
Okay. Okay.
Just going to check to make sure, but that's what it sounds like.
Okay.
You can get undressed and put the gown on.